Thank you for joining us. This is Conversations for Showing Up for Kids, or aren't showing up for kids. I don't know my own title sometimes, but I'm Tim Markle. I'm the director of the Southern Regional Center for Children and Youth with Special Healthcare Needs. We're based out of the Wasteman Center. We cover 14 counties in southern and southwest Wisconsin. Conversations is a way for me to reach out and get to know a little bit more about the people that are supporting the system of care, some of the families involved in the Children and Youth with Special Healthcare Needs Network, and just generally trying to let people know what's out there. A little more information never hurt anyone. I do want to remind people that we try very hard to not use any identifiable health information or public information, as this is being recorded. And we know that once something is out on the web, it is out there forever. I am really excited today that I am joined by Kristine Alaniz, who is the manager of the maternal and child health programs at the Wisconsin Women's Health Foundation. And the Wisconsin Women's Health Foundation operates the Well Badger Resource Center, one of the key components of the system of care for children and youth with special health care needs. So Kristine, so glad that you could join us today.
Thanks for having me. I really appreciate it.
Absolutely. And we're going to go slightly different, as people that have been listening to these in the past know that generally I ramble on and I ask questions and then we ramble on some more. We're going to do something a little different today. And so Kristine has brought along some visuals to share. And so if you want to go ahead and share your screen and share your presentation, and I will just sort of lurk in the background and ask questions as we go along. Does that sound okay to you?
That sounds great. And thank you for humoring me and letting me bring slides. I'm a visual person, so it helps to look at something and it prevents me from over rambling, which has been known to happen. So I will get those slides pulled up.
Well, you pull up those slides because my whole danger, of course, is that once I do it for one person, then everybody's going to want me to do it for them. And that's just not going to be, there's just only so many PowerPoints. So
right.
You told me that it is a PowerPoint, but it's also designed to be a discussion. So we're going to go with that.
Sounds good. Yep.
All right. So tell us about Well Badger Resource Center.
All right. I will. I'll just jump right in here. So a little bit about Well Badger. Our main mission and goal is to connect individuals and families with health and social services throughout the state. And we do that in a couple of different ways, which I can talk about in a little bit. But some of the background, kind of where we're positioned, what exactly we're doing, who we are. We're managed, like you said, by the Wisconsin Women's Health Foundation since 2018. One of the services that we've had, which is a phone-based assistance program, has been around for a couple of decades. You might have heard of Wisconsin First Step or the Maternal and Child Health Hotline. Those are DHS-sponsored hotlines. Those still exist. They just now fall under the umbrella of Well Badger Resource Center. So wanted to get that cleared up right from the get-go. And Well Badger is funded.
There are people, just so you know, I totally appreciate that, because
Yes.
I know I have a lot of people in the network. I've been working with children and youth with special healthcare needs for over 11 years that we got very used to First Step.
Yes.
First Step, have parents call it First Step. And so knowing that First Step still exists is just now part of Well Badger.
Yes,
really
exactly.
Important.
Yep, the phone line is completely functional, so it still exists. But when we pick up the phone, it's going to say Well Badger instead of First Step. So you're in the right place. A little bit about the funding too. So it's pretty unique in that the Wisconsin Department of Health Services pools funding. So although one of our special populations of focus is children and youth with special health care needs, we also focus on pregnant and postpartum people and low-income families, and especially low-income women. So that's why there's kind of this pool of funding that you see here. And then that's our team in the picture on the right. So I can just keep rolling here and I'll pause. Interrupt me if you want to.
You know, I'm just wondering, how do I enroll in programs like Badger Care and Food Share?
All right. So on the left are the different specialty areas that we focus on. And you'll see children and youth with special health care needs is one of our main ones. And then we have the other program or the topic areas that we focus on. And then on the right are these different examples of questions. So enrolling in these programs, we have a lot of families asking, I don't get Katie Beckett, I don't get children's long-term support waiver, or they don't even know they exist, which I'm sure you also run into. Again, we serve a lot of pregnant postpartum people. So we have people in a really tight spot. I don't know what to do. Can't pay my bills. Not sure like how to get insurance and make all of this work. And then a big one, obviously the last 10 months, is we're getting a lot of inquiries about COVID. A lot of inquiries. So a lot of people have lost their job or they have limited employment. They can't pay their bills. So what are they all eligible for? Maybe they've never used any of the benefits, the state benefits that are out there. So it's helping them navigate all of that. And another question we often get is about finding, accessing, or paying for children's mental health services, which a little bit later on I can get into those details because that one is a challenging one as well.
That's a huge topic. And one of the things that I really like about this is the fact that when you call Well Badger, is let's say it's a family with children and youth with special healthcare needs, is your information referral specialist can also then assist with those other questions as well.
Yeah,
because we know that families don't exist in a vacuum.
Yeah, exactly. Yeah. And, you know, some of the inquiries that we get, some of the families that reach out to us, it might be a really simple need. We're matching them with one service. It's, you know, a 5-10 minute interaction. We get a lot of cases where it's way more complicated than that. There's 10 unmet needs. And so then we're really working with the family to try to figure out what is the top priority, like what do you need right now, urgency wise, or with some of the services that get complicated, what is step number one that will open the doors to other resources? So that's what our team on the number one here, information referral services, those are our, actually, let me just go to the next one. So we have resource specialists that are available to work with families or work with individuals on that one-on-one basis. What is your story? What are your needs? How can we help you? With the end goal of getting them plugged into different services. And that could be medical, that could be social services, financial support, all of those different things that are out there. I wanted to point out too that health professionals can also contact us on behalf of a client. So maybe they have a patient or a client with a really complicated situation. I don't know what to do. They can't get these services paid for, or I don't know where to refer them. So they can call us on behalf of that patient. And our team is really good at just doing research. We don't have all the answers, but we will, I promise you that we'll figure it out.
I've met some of your team and that is very true. They're go-getters. They really care about what they do and they want to find the answers for families.
Yep, they're detectives and they will figure it out. So those the resource specialists, they're available Monday through Friday, 7 a.m. to 6 p.m. And families can connect with one of these specialists. They can call, text, email. They can do Facebook Messenger or live chat on our website as well. And I wanted to point out that we do offer interpretive services, so any language can call in. What we're working on right now, hopefully within the next couple of weeks, we will have a dedicated INR staff to handle the Spanish inquiries that are coming in. So,
okay.
Yep.
Cool. Yeah. So, and people understand are the interpretive, how do they know about the interpretive services? Like, is that part of the voice message that when they call it gets explained, or do they have to try to explain it to someone?
Yeah, when they call in, you can be routed to English, Spanish, or Hmong. Usually if it's another language, like for example, we've had someone call Russian or Mandarin Chinese. Absolutely. They usually get routed in somehow, and then we'll just do an outside line to get those services, interpretive services for them. Yeah.
Cool. And yeah. I really like the fact they say health professionals can contact you as well, because I know that there are some places that have nurse professionals that are serving as case managers or care coordinators, or they have social workers. And always trying to figure out, who else is out there in the system that could help this family.
Yeah.
And absolutely. So one of those answers might be Well Badger Resource Center.
And we realize that a lot of health professionals, a couple of situations, they are incredibly busy, and to find some of these resources, especially the complicated cases, that takes a lot of time. Well, we have staff who love doing this, so let them help you find those services. We also run into a situation if someone serves a large geographic area, or maybe they have someone who, lives just outside Milwaukee, for example. I know all the Milwaukee resources, but I don't know what's in Washington County. So because we're statewide and we have a listing of all the statewide services, we can pull those up and get people connected that way as well.
Well, that's a lot of ways that people can get in touch with you.
Yeah.
That's really cool.
Yeah, I can talk about that last one a little bit, our searchable directory. So it's Well Badger.
Just in case I don't know why somebody would not want to talk to you, but let's say it's 2 a.m. and they have some questions. This is one of the great places that an online directory can helmet.
Yeah, yes, absolutely. And this is one of the services that we provide again for people who want to search on their own, or they're curious. We have a lot of users use the directory, and a lot of health professionals use it as well. So they can definitely use this. It's a resource open to anyone. But the two different, well, I'll start by saying we have a lot of stuff in this directory. We're up
Yes.
to now 4,000 programs and services. So to access those or see what's out there, the first image there, you can see there's just a search bar. So you can just type stuff in and your matches will pull up. So that is good if you kind of know what you're looking for. If you don't know, you can search by topic. So you can see on the bottom, there's the button Children with Special Healthcare Needs. You can click on that and you'll see every service available by category. So you can say financial services, click in there and kind of see what's there. And then you can sort by location and try to, navigate that way.
So
So
once they go into a category, they can still sort within the category. It doesn't just
yes.
bust out those 500 things, but you can then search and narrow it down and say, okay,
Yes.
within this is what I'm looking for.
Yeah, I think under children youth with special healthcare needs, we probably, okay, don't quote me, but I would say around 15 different subcategories. Then you can click in and then sort by location, because we know that's a big thing for people.
Yeah.
Yeah. And we like to say this is not a Google search. We are quality over quantity. And everything that's in here, it has to meet strict criteria. It can't be businesses trying to promote a product or a service that costs, a lot of money. It has to be either on a sliding scale, free, or it has to be Medicaid covered. Otherwise, it's just not in at all. And all the information has to be verified by the agency that provides the service. So
How do you do that?
we have a whole team, they're called resource management team, and they're the ones that are verifying every single year to make sure everything is up to date. And then special circumstances like COVID, for example, a lot of agencies went from in-person to telehealth, or they have different hours. So we're able to update that really quickly. We actually have it in red under all of the listings that opted to do that. So you can see, okay, this is telehealth only now. You can make that decision before you connect with the service. So yeah. The online directory too, we're really excited. The Spanish version is coming very soon. We'll be able to flip the whole thing to Spanish, which has been a pretty huge undertaking because it's a lot of words in this directory. So we're super excited about that.
And I know from my experience at the regional center is it's not always easy as a word for word translation. That's not the way that it works.
Right.
And so getting the right word in Spanish to communicate what you're trying to help with can sometimes be difficult. So I totally appreciate that takes some time.
Yes, absolutely. I have one other thing to talk about with the online directory, if that's okay. I'm going to actually,
Please.
I'm going to skip that. Okay, so remember this slide we talked about with the examples of questions. And this one, I said, well, we should come back to this one because this is one of the examples of the really complicated cases. Every time we have something with children or adolescent or young adult mental health, it gets very, very complicated. So,
and Christy, I can tell you from the regional center point of view, at least the Southern Regional Center, this is an area where we get quite a few calls. It's always at the top of our categories. It's calling about mental health services. So I know that families are constantly looking for help in that area.
Yeah, they're looking for help. They're confused. They don't know where to go. They don't know what steps to take. And I can say that from personal experience too. As I'm working on this project, I'm living it in real time. So I really get it. And I really empathize a lot with the families that are struggling with this, especially those that don't have a lot of resources or support to make it happen or to connect with resources. So what we have been working on for almost 2 years now is a Children's Mental Health Resource Navigator. So the basic concept is this is a build out of our online directory, but instead of I'm looking for this, here's the resource. We're taking parents through steps to find out what are you eligible for, what needs do you have, and try to really precisely match them with the resources that they're looking for, but also what resources their child might be eligible for that they didn't even know existed.
Mm-hmm.
And
exactly.
then, and the other thing is, like we were talking about before, for a lot of these resources, you have to follow a lot of steps. You need your prior authorization before you can get this assessment, or you're going to get a bill for $5,000. So
Mm.
it would be really good to know that. Oh, what happened? So anyway, so the tool is, there's a questionnaire. A parent or a caregiver can fill out this information about their child. It's pretty basic. It's completely confidential. You don't put your name or anything in there. But we're asking about things like, do you have insurance? Do you have Badger Care? Do you have a primary care physician? We ask about, has the child already been diagnosed with a mental health or behavioral health condition, or are you looking for an assessment? If they've already been diagnosed, what kind of treatment are you looking for? What kind of support are you looking for the child and for you as the caregiver? Basic needs, all of these different things that are listed on the right-hand side, which is a visual. We've been working with Office of Children's Mental Health to get on the same page and use the same language. So we ask this information about the family, and then they'll receive a customized resource guide that they can download, they can print, so that they have step-by-step instructions of what to do. What are the local resources that are available to them? And then there's links to these documents to explain things more. I think the vocabulary is really tough. Insurance
Yes.
vocabulary, I don't know. So we have ways of explaining these things so when it comes time to accessing resources, they know what to say. They're using the vocabulary to get things moving a little bit
Right.
faster. So we're really, really excited about this. It is fully built. We are just about to we're doing internal testing right now. And then in February, we're going to be doing external testing. So any family who is struggling with this in real time, or has struggled with this in the past, or any professionals that work with children with behavioral mental health challenges. We really want their input because we want this to actually work.
So are you looking for some beta testers,
We're looking
basically?
for some, thank you for asking. We are. So anyone who wants to test can just email me with the subject line, Children's Mental Health CMH Testing. We're going to open it up February 22nd to March 12th. It does take about 30 minutes. You can spend way more time if you want to, but we're asking for about 30 minutes to actually do a real scenario, see what messages make sense, if there's anything that's off. And then the other thing we really want to do is make sure we have enough resources to populate it. So we're asking folks to think about, oh, you know what, I'm wondering why this resource didn't show up here, to let us know so that we can get it in, so that in the real world that does show up for a family.
So I would assume it would be really important too to have families either actually from, or professionals actually from, or test to be from places like Vernon County,
yes,
which is pretty far away from Dane County, and it's one of our
Mhm.
smaller counties in the southern region, or Lafayette.
Yes.
And to make sure that there is something available for families in that area.
Yes, absolutely. That is a huge need of ours. Before this, even the testing started, we did what's called a gap analysis. So it sounds fancy. It's actually not that. It's more time intensive than anything, where we looked at every county. We looked at what resources do we have for assessment and diagnosis. For counseling, for different support programs. We need to make sure that there's something in those counties for each one. So from that, we found the gaps and we've been filling them in, but we have a long way to go. And we know that people, they really know their communities, and we would love that local knowledge to be able to build this. The more people use it, the better it gets. So yes,
So
thank you for
they could be testers and provide feedback on how it worked and maybe what's missing.
Yes, absolutely. That's a much more concise way of saying what I just blabbered on about.
Well, I'm just thinking in the future is that hopefully this will recording will be accessible and usable for many months, but especially if you're listening to this before February 22nd, reach out to Chrissy, because
Yes.
we really want this to be robust. We want it to be usable. We want it to make sense. I hate things that are planned by people that have never been in those situations, because
Right.
then people that are in those situations read what they wrote and they're just like, yeah, that's cool. That's not me.
Right. Yeah. You're completely clueless.
Yep, exactly.
Yeah.
And then hopefully in March, if somebody's listening to this in April, they're going to be able to go ahead and use the mental health navigator.
Yep, absolutely. That's the goal. And actually all the way up until March 12th. So even if you email me on March 11th, you can still do it. We're going to close it March 12th. So
Okay, and then probably a little bit of time for retooling, and then
Yep.
open the floodgates.
Yes, absolutely. Yep.
Well, I think this is going to be a really useful tool because, like I said, this is an area that families struggle with, as we know.
Yep.
That the mental health system of care is not where it needs to be for the people in Wisconsin. Is that we can do better. Is there are people that need help that are not receiving that help. There's help available that people can't seem to access or they don't know about.
Right.
So there's a lot of work that can be done.
Yeah.
Were there other partners that were working with you besides the Office of Children's Mental Health on this navigator?
Yeah, that's a great question. I actually wanted to give them a shout out because that system map, that was really hard to pin down the right vocabulary that was, descriptive enough. So we've really enjoyed working with them. From the very beginning, with the initial concept, the regional centers, we had several regional center staff give feedback on the original concept. And then we had, I think it was about 150 professionals and parents, caregivers give feedback on the original concept. So there were folks from Children's Wisconsin. I'm going to forget a bunch of them, but a bunch of different agencies. And then we had about half of those were families with lived experience that did the testing. So this isn't starting from scratch. Now we're really looking more at the, functionality and making sure the resources are there to, to populate the resource guide. So it's been really good. The Children, Youth with Special Healthcare Needs network in Wisconsin is strong. I love seeing how people are working together and collaborating. Everyone has their niche, and so it's been really great to have everyone joining together to try to build this thing up. So we're really just the tech people behind the screen getting it up there. So.
Well, that is, I am really excited to email you and take my own test drive through, not only as a professional, but also as a user of the system with myself and my children. So it'll be good to go through and see if, what if I had this 10 years ago, would I have been able to find help quicker than I was able to?
Yeah.
So I'm looking forward to getting that a test out.
Good. Great.
All right. Well, that is, unless do you have anything else that you would like to share today?
I don't think so. Just thanks for the opportunity. It's great to connect with you. And this is great. This is a great series.
Absolutely. Well, I am, of course, loving it. And I really, I will echo what you said about the system of care, is that it's not, and what I really like about it, between the regional centers and Well Badger, Family Voices, Parent to Parent, ABC for Health, the Youth Health Transition Initiative, the Medical Home Initiative, is they have their own little niche, their areas of expertise, but rarely do you see any of them doing anything alone.
Right.
You're going to see everybody cross-reference, because we know not one person can do everything. I mean, I'm sure there's even a time when somebody would call Well Badger that you would refer them to a regional center.
Absolutely. Yep.
And so the system is made to work pretty interchangeably, so that people are getting the help they need, whoever they call.
Yes, exactly.
That's the goal.
I love the concept of no wrong door. We're going to help you. And because we have this network that you talked about, where we're interconnected and we all know what each other is doing, you're going to get to the right place. Just if you need something, just pick up the phone, jump online, get the ball rolling, do one little thing. And you have this amazing network of people here to help you and support you, who've been there. But we'll listen to your unique story, because everyone is so different. So yeah, we've got you.
Absolutely. Oh, maybe that should be our new catchphrase. We got you.
We got you.
I like it. I like it. Children, Youth with Special Healthcare Needs program in Wisconsin. We got you. We got you.
Great. I think we're onto something here.
Oh, fantastic. Well, thank you so much for taking time out of your day to share with us. Really excited to see the Navigator, Mental Health Navigator, up and running. Really excited if some of our parents can get involved in that. I hope that you'll be sending some information so I can share that with my parents in the Southern Regional Center. And let them know about this opportunity. I'm sure there's some of them that would love to take you up on it, I hope, as I will myself. So thanks again, Chrissy. And if you get any new developments, when you add new stuff, let me know. And we'll just bring you back and we'll lay it down again and talk more about Well Badger. I really appreciate your time today. Thanks a lot.
Will do. Thank you very much. Bye-bye.
And if you want to hang on, I'll talk to you again in a minute once I stop the recording.